Hello and welcome back to GP Video Podcast by Nadia. So today the topic that I'm going to start is again a gynecological issue, but again, just like heavy menstrual bleeding, it's a very important topic. It's a very common disorder affecting 1 in every 15 women of reproductive age and has got a lot of consequences, a lot of issues related. So I don't know how many video podcasts would I be making on it because it's a very important topic and I really want to delve into the depths of it so that we can together understand its importance, its complexity, its symptoms, its investigations, and its treatment. Okay, so the condition is polycystic ovarian syndrome or polycystic ovarian disease. Again, there is a difference between the syndrome and disease, but I'll shed light onto it later. We'll start with polycystic ovarian syndrome. So, according to the experts, it is a constellation of symptoms rather than a specific disease. So it is a constellation or it's a combination or it's a group of symptoms rather than a specific disease where the cause or causes are not completely known. Yes, we do know of a bit of risk factors. Yes, we do know pathophysiology, but what is the exact cause or causes, that's all. It's still under research. So the other definition is that polycystic ovary syndrome is the most common endocrine disorder affecting women of reproductive age, affecting 10% of women population of reproductive age. So endocrine disorder means disorder of hormones of the body. So again, the syndrome is the most common endocrine disorder, hormonal disorder affecting women of reproductive age, affecting 10% of women. So reproductive age is from menarche to menopause, which is around whenever the first cycle starts from the last day of till the last day of the last cycle. So reproductive age basically anywhere between, let's say, 15 years to 50 years or 13 years to 50 years of age. Okay, so when it is the most common disorder, hormonal disorder, then we should know a lot about it. As I said, it is a constellation of symptoms rather than a specific disease where the cause or causes are not completely known. Interestingly, while as the name suggests, polycystic ovarian syndrome or polycystic ovarian disease, and ovaries should have cysts, but that is not always necessary. So again, the disease or the syndrome could be there without even the presence of cysts. So many patients who have PCOS are usually, I'm talking about majority, I'm talking about most of the patients who have PCOS are overweight or obese. Okay, so again, being overweight or obese can be one of the risk factors to develop PCOS, or alternatively can be one of the consequences of having PCOS as well. So again, it's very complex. It's like a vicious cycle. So you could be obese and that could be one of your risk factors to develop PCOS. But then again, as a result of PCOS, you can become either more obese, or if you were not obese in the first place, you will become obese, mostly. So that is one of the complications. As I said, it is one of the most common hormonal and reproductive conditions in young women, affecting 1 in 15 women globally. So the etiology of polycystic ovary syndrome is largely unknown and is thought to be multifactorial. So there is not one cause, but there are so many risk factors for developing PCOS. And the more risk factors you have, the more likely you are to develop PCOS. The genetic inheritance of PCOS is heterogeneous and complex. However, it appears to be inherited in an autosomal dominant fashion. So autosomal dominant, so again, the genetic factors or, family history of PCOS or PCOS being in the genes is being largely researched. And it is thought that, it is inherited as autosomal dominant. Autosomal dominant means that only one parent gene can predispose you to developing this condition. So which is again, not too good. Postnatal obesity appears to be the leading environmental contributor. This is another of the thoughts that After giving birth, the obesity that usually women encounter could be one of the leading one of the contributors. So other risk factors for polycystic ovary syndrome include, again, as I said, obesity, number 2, diabetes mellitus, type 2 diabetes mellitus, insulin resistance, high sugars. Again, we are talking about the metabolic syndrome here. Family history of PCOS, genetics, again, the autosomal dominant disorder that they have categorized it as. And also premature adrenarche, which means early onset of pubic hair. Again, it's an hormonal issue and it is one of the risk factors. So today we have spoken about the definition of polycystic ovarian syndrome, and also we have talked about a bit about its pathophysiology or its risk factors. Sorry, we haven't spoken about the pathophysiology today. We have only just touched a bit on the risk factors for developing polycystic ovarian syndrome, and tomorrow I would like to indulge more into pathophysiology. I'll talk to you then. Have a great day.